All right. So today, the topic we are taking is something of great interest to me because it brings another perspective. It brings another way of looking at things, which is the dental link to meridians. That means, we have our teeth and we go for our regular checkup or cleaning, but we just limit it up to that only. But there is much more to that, much more of a scientific facts behind it, or the linkages, not just our teeth and health of our specific or in general the dental kind of health condition. So we all know that, yes, as a kid we sometimes hear parents telling us don't eat too much chocolate or too much sweet, it will impact your health. Or the teeth will decay or cavities. These are the usual things, parents talk about. But one of the key thing is, because there could be many different issues one can develop when it comes to your teeth. Periodontitis is basically any of these conditions. It could be the plaque, it could be the gums infection, swelling, inflammation, and all those kind of things. And usually we just say, okay, I have this problem, so I have to go to a dentist, which is good, which we must take care of. But there is the other side of it too. And the other side is that our teeth are connected to the rest of our bodies, means different organs, different systems. They are not in isolation. Now, meridians that we have talked about before, meridians, these are invisible energy path, just like what we call nadis in traditional Chinese medicine, TCM, and they call meridians. And different meridians connects to different body parts. So it's not that your teeth are just, related to situation or condition in your mouth, like gums, teeth, and all, but it goes way beyond. Now, if we leave these issues untreated, it can cause different issues in different part of our body. It could be in your heart, could be in your intestine, it could be in your brain, kidney. So now this becomes something of great interest, because now it is not just we are talking about the teeth, but your overall health. Now, when we are looking into this, the question comes, could this be avoided? That means, can we analyze this information and try to understand what our body condition is? So when we have any kind of issue, whether it's inflammation or any other cavities, root canal, and all those things, can they be indicating that we have some issues somewhere? Or while treating this, can we impact any of our organ or systems? So, sometimes we end up with some neuro degenerative issue, autoimmune diseases, cancer, or it could be related to heart, any of the body conditions. So is there a link? Is there a connection that we can say, yes, this could be one way of interpreting or understanding? So our teeth and emotions, is there a connection? Is there a clinical proof that these two are linked? And the answer is yes. Different papers, different research has proven that there is a link between teeth and emotions. Now, we will look into that. When we say teeth, means because obviously there are multiple, and what does that mean and how they are connected to emotions. Sometimes you may have heard some people, they snore, they grind their teeth. And when you're grinding their teeth, is this related to just your mouth or some kind of habit, or is it related to your health overall or related to emotions? Because generally we look into these things in isolation. We just think that, okay, if a person is grinding, okay, the person grinds, you cannot do anything about it. Or snoring means, okay, it is what the person does, and we think it's the air passage and other things, but is there a link between the emotion as well? So when you look into different teeth, because top and bottom, you have different sets, and we say, okay, overall total as an adult person, you may have up to 32. And if we try to link, can we see different emotions attached to it? So when we look into this chart and you see the different teeth, so there may be more than one attached to one particular organ or system. And then, of course, every organ is linked to a one or particular emotion, or the other way around, every emotion has a linkage to some organ. So whichever way we look at it, there is a clear linkage that tells us that, yes, they are connected. Whether you are looking at your, heart, intestine, whether you are looking at your lungs, spleen, because these are the meridians. What you are looking at, they are different meridians, and depending on the relationship, you will see different teeth number attached to it. So total 12 meridians, and that's what you're gonna see here. Different teeth number, and then the emotions attached to that particular teeth. And that gives you first hint that yes, your teeth, the condition, the situation, the indication are not only just your teeth condition, but your overall health condition. If we understand this, then we can talk to our body, because that is the one of the first condition that you want to achieve, that yes, I know what my body is telling me. Now, it may not be precise because different emotions may have some overlaps, which is fine, but at least you will get some understanding. Certain emotions you will see it's very common, it's happening, so you may wonder that, okay, most of the people may have, that's okay, but there will be a variation in the degree. In your case, which emotion is a strong one? In your case, which one is the one that is, throughout the day you are feeling it? And that's the thing that you want to identify. Sometimes we say, how do I know something was happening inside? And, generally, when it is diagnosed, but it's too late, or it has gone to a level where now you have to get allopathic treatment or surgery or those kind of things. So this is one way of understanding it. Now, let's look at it from another perspective. We have talked about, Panch bhootas. Our body is made up of 5 elements. Whether it is space, water, air, earth, fire, any of these elements, it's a combination. And we can see here as well that how these Panch bhootas are also linked with different teeth. So you have meridians, invisible energy path, you have these Panch bhootas connected, and you have different organ systems. So you see all these are interconnected, and it reflects not just our teeth condition, but the overall health. This information could be really useful, because if you say, okay, I'm having issues in this teeth number, so you can see the TCM along with the Tri-Doshas, you can see with respect to Panch bhootas, and you can understand that, okay, which organ, which emotion is connected to it. Now, you can see same kind of information in a different perspective, which gives you specifically, okay, these are the organs connected or linked with these other glands, and which are the elements, and then what's happening. If we understand this relationship, and if we understand what's happening in your particular case, you can ask your dentist, okay, you just did a filling, what was that particular teeth number? Or if you are going for some treatment or gum issues, you can just ask what is the teeth number, and later on you can relate to it. Because now you know that if this particular teeth is having some issue, what maybe it's not something that you go directly and all of a sudden you start worrying about that particular organ, but this is an information that is good to know, and look into that emotion, that is it correct that that particular emotion is a prominent one that is causing you this particular impact. And again, it may be visible in your teeth first. Organs are internal, you may not know, but this will give you a hint. This will give you some indication. Now the question comes to know more. So this is one website where you will get this interactive chart. And if you, just go on this website, based on the teeth number, you will get the related information easily. So it's much easier. You don't have to memorize. You don't have to have the chart hanging. You can easily go and get this information. So what you will see here is, again, which meridian, which organ, and then what are the other possible relationships, but what are the major organs that is impacted by this particular teeth number? And that's what we are trying to see here. And if you can see, then yes, you can prevent many things. And when we are talking about these things, again, whether it's technical paper, whether it's research, or IABDM, which is this International Academy, Biological Dentistry and Medicine, and you will see different information notes, but one particular research, which is root canal related, and root canal, like, it's so common. Like generally you will hear someone going for it, and we don't even pay much attention to it. We don't see that as any major issues, but there are different research which point out, and one particular one, Dr. Thomas ran in Europe in its early 90s, 1992, around that time. And his research has shown that how there is a correlation. In fact, in one of the case, which was the example of a breast cancer, his research has shown that 98% of those patients who had the breast cancer, one of the more, canal teeth of the same meridian where this tumor was originated. So this shows the relationship between the illness and oral health. And then it depends, again, on the emotions that was researched, that how, when we are talking about it, is it true? Now, not only on humans, then this was tried on, animals. Typically, they will use either mice or rabbits, those kind of things. And when they tried this relationship, when they used, in this case, they had used, Dr. Price has used rabbits, and then the health of rabbits quickly developed the same illness as the disease of the people who had the root canal teeth. So root canal is not just, like going and getting it then if we can avoid, that's the best. But getting it done, you fix one problem, but you are opening the doors to the other. So this is one thing where certainly we should keep in mind. That's why this health, not only on the teeth side, your oral health, but also your overall health, because the more you get into this, nowadays it is so common, we get the cavities, root canal, and we don't think about it. But these things do impact your overall health. There is a straight connection between root canal and diseases. And that is what one should remember. So it's not just going and getting it done, it is impacting your health. So different type of illness, diseases, with different research, it is clear that there is a linkage. It's not just, getting it done and hoping everything is fixed. By fixing this, because you are working with meridians, you are working with different nerves ending, and that's why this root canal thing does impact your health. So you fix one thing, because if you don't do, there is inflammation, there is some, infection that needs to be fixed. And that's why we say prevention is better than cure, because by fixing one thing, you are actually creating another problem. And different illness, different diseases, emotions and connection, that is, it is bringing those two things together. So that interactive website, that is one way of knowing, more about it. And again, it's not getting in a habit of always, reviewing that. But if you know that you're having particular issue in particular, teeth, then it is good to know more than just that situation. And if you understand, then certainly you can avoid it. And if you cannot avoid it, at least you can fix it before it gets too big or before it gives you more trouble. So hopefully, masters, this information will help you in preventing a lot of things in your life, rather than getting into the the allopathy, or getting into the treatment and then the side effects, that kind of thing.